How to treat drug dependence. The easiest thing is to abstain and stop, but that is not likely to have an enduring recovery. The problem is a person can go through withdrawal syndrome. With most drugs and alcohol, there is going to be some form of withdrawal where they feel very unwell, very sick, and all they want to do is feel better, and they know that the quickest way to feel better is to take more of their drug of choice. So over the long term, going cold turkey is not the best way. Instead, there's many other options out there. So for alcohol, speaking to your healthcare provider to get on a medication that helps ease the withdrawal syndrome. The same thing can be done with the opioids. There is opioid replacement therapy known as Suboxone. The older one is methadone. And these drugs help to minimize the harm being done. So instead of going cold turkey, which has low likelihood of enduring recovery, instead is to replace their drug of choice, the opioid drug of choice, with the opioid replacement therapy, i.e. Suboxone, which does not cause the high of the drug, and they can slowly wean off the Suboxone, and in this situation they can continue their normal daily activities. So the other option is rehab, and rehab is more for total abstinence, and I would recommend this as the first line of therapy. So abstaining on your own is not adequate. It's abstaining on your own and having lifestyle changes that I think is the most important thing, and this is where rehab comes in, because as an inpatient rehab, we're buffered from the stresses of outside life and can focus on ourselves. I know this because of personal experience, being in rehab for over six months in total. So in this, I think it's a very healthy way to ensure complete abstinence, yet at the same time developing the skills necessary to ensure enduring abstinence. Things like being honest, being candid, sharing my feelings with others, listening better to others, practicing mindfulness, learning to meditate, learning how to deal with my stresses in life and to cope with them without relying on my crutch. Now those are the most important things that come in very handy to not only coping with recovering from my drug of choice, but it turns out that these same things are also helpful to enduring happiness. One thing I didn't add in there is being connected with other people. That's another positive thing about rehabs, as well as enjoyment of recreation and entertainment things in life, to have some balance. So to treat addiction and to have an enduring recovery depends on multiple factors. And to summarize, the way to treat it is not only to stop, but to ensure there's enduring abstinence, which is a tough thing to do, but this can be accomplished with replacement medications, whether it's ones for alcohol use or ones for opioids. Once a person gets stabilized on these, to slowly reduce the dose of these medications, but then also engage in an active program where they're involved and connected with other people. This can be done in rehab as an inpatient or an outpatient, but it's when a person is now learning the skills necessary to change the way they live their life, the way they look at life, and how to deal with stresses and to be able to have an enduring recovery.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.